Hey Skinsters! I know you noticed that my skin is a bit shinier than usual. It's not because I'm windshine, although that is true too. It's because I just got my Morpheus treatment. I am hooked on Morpheus. It's true. So I wanted to talk about my post-treatment care a bit because I get a lot of questions about it, and I think the more explaining the better. I keep changing my regimen all the time also. I try new things and I see what works, what doesn't work. So right now, currently, this is what I do. First of all, I put on my Elastin Regenerating Skin Nectar for 2 weeks prior to the procedure because this helps clean up old debris of collagen and elastin, so it makes room for your body to build new collagen and elastin, which is what we're doing the Morpheus for. And so that augments procedure, and that's going to give you double the awesome results. And in post-procedure, this is what I put on for the first week or two until everything heals up. Another thing that I put on immediately is I put on the Elastin Enhance post-injection serum. So as you notice, I have a little bruising on my eye. It's because I used a prime tip. The prime tip is smaller, it gets in all the little eye areas, and it really helps lift the hood, it helps with eye bags, and those are my main challenges, I would say. So I do like to use the prime, and as a result, there's gonna be some bruising. There's a lot of vessels around the eyes. So we use the Enhanced post-injection serum right away. Next, I use a recovery balm and just a full layer over the entire face on top of the Nectar and the Enhance. And what that does is that forms a skin barrier, because essentially what we did was we poked a bunch of holes in our skin and causing that barrier to no longer be there, and bacteria, pathogens, all kinds of things can enter your skin, which you do not want, especially after the Morpheus. You want to keep things really clean so you don't get any infections. So that's why we put this recovery balm on. It's also really important to stay moisturized. So I'll put the recovery balm on for the first day or two until I know that all the holes, have closed up. And then I'll start to use the moisturizer. So I'll use the moisturizer a lot. Like I'll maybe even use moisturizer a few times a day. Anytime I feel like, oh, it's starting to feel a little drier, moisturizer. I also use different sprays. I'll use like a rose water spray. I'll use like a hyaluronic acid spray, depending on how far along I am. Immediately after the procedure, I don't want to use too many acids. Another thing I started doing just recently is I've started doing Arnica. So I learned that Arnica, the way it works with the grading system is the higher the number, the more chronic the trauma. So you might think that like 30C means that it's more effective, but not really. It just means that it's a long-term chronic pain. Whereas something smaller like 9C, that's for more recent trauma, which I count the Morpheus as because I just got it done today. So it really helps with swelling, it helps with discoloration, bruising, all of that. So super great. I also started taking collagen pills, taking hyaluronic acid pills, taking glutathione because it's antioxidant. Like right after the procedure, like I'll take some of that and continue on a little regimen of that. If I decide to go out that day, I will definitely be using my full face visor. I try not to put anything on my face, meaning sunglasses, mask. I try to avoid all of that in the first 24 hours. Definitely no makeup. Try not to even use, any kind of cleanser, because it could be harsh. So I just try to leave my skin protect it with these balms and nectars for the first 24 hours. Thereafter, you can use a gentle cleanser, but definitely no acids, no chemical peels or anything for 2 weeks. And that'll be the best for your skin to fully heal so you don't get any post-inflammatory pigmentation. But after the first 24 hours, definitely cake on that sunscreen. Cake on the sunscreen. You heard me talk about the Elastin sunscreen. It's the best. And it also is tinted, so it works as a concealer, it works as foundation, so that's pretty much all you need for makeup, I think, for your recovery period at least. And definitely hydrate a lot. Drink so much water, drink tons of water all the time. Hydration is just the best cosmetic, honestly. And on top of hydration, you want to avoid alcohol. You want to avoid it for 3 to 4 days before the procedure so that you don't have thin blood and you don't get more bruising, more swelling. And you also want to avoid it post-procedure because you don't want to be dehydrated, and that's gonna slow down your healing. You're gonna want to sleep on clean sheets. You're gonna want to sleep upright. I know I'm a front sleeper and a side sleeper, so I totally get it. But just for the first, 24 to 48 hours when those holes are closing, you want to have clean sheets and sleep upright. Yeah, that's basically it for now. So have the most awesome Morpheus recovery, and enjoy your skin and have a wonderful day.